Local health authorities re-emphasize citizens won't be able to choose which COVID-19 vaccine to receive. There will be a new set of guidelines for people who have received both shots, such as self-quarantine exemptions. Jang Tae-hyun explains further.
South Korean health authorities have again emphasized that people are not allowed to choose which COVID-19 vaccine they receive. Commissioner of Korea Disease Control and Prevention Agency, Jeong Eun-kyeong, at a briefing on Tuesday said it's more effective to use a vaccine that's suited to that person rather than giving people the option to choose.
It's still hard to say whether we'll let people choose a vaccine in the third quarter. By then, there will be more vaccines from companies like Pfizer, Moderna, and Novavax. So we are building a vaccination plan based on that.
People are not allowed to choose their vaccine. Rather, health authorities decide for them. People aged 75 and older are being given the Pfizer vaccine, while those who are part of the emergency services, such as police officers and firefighters, are receiving the AstraZeneca vaccine. South Korea announced on Monday that it has secured COVID-19 vaccines for 99 million people, enough to inoculate close to double the population. But if the country is to inoculate 70% of the population and reach herd immunity, vaccination plans for next year could change depending on what happens in the second half of this year. Whether adolescents will get their shots or if people receive a third booster shot will have an impact on vaccine supply. Health authorities also say that they're considering self-quarantine exemptions for people who have had 2 vaccine doses if they have come into contact with a confirmed patient or if they have come from abroad. They'll also draw up a set of guidelines for those who are fully vaccinated after taking advice from the Disease Control and Prevention Centers of the US and Europe. Meanwhile, Acting Prime Minister Hong Nam-ki on Monday said that the country will vaccinate 70% of the population by late September and reach herd immunity as early as possible, even before the original target of November. As of Tuesday, over 2.4 million people, about 4.7% of the population, have received their first COVID-19 vaccine doses. Jang Tae-hyun, Arirang News.